Hello, everyone. My name is Dawn, and if you joined us for our last webinar, I am delighted to welcome you on behalf of the EQ Stable team to this one as well. We are delighted today to have Dr. Nathan Voris with us to help us with this topic around deworming, this demystifying deworming. But before we begin, let's talk for just a second about a few logistics. Dr. V has prepared a lovely summary of our topic for us for about the first 30 minutes. He's going to run through some slides with us. And then once we finish the slides, we'll have a question and answer period. Now that doesn't mean that you have to hold your questions to the end. There's a questions component and there's a chat component in the webinar dashboard. Anytime you think of a question, please feel free to send it to us and we will queue all those questions up for when we get to that Q&A session at the end. If you're anything like me, you'll forget your question by the end of the webinar. So go ahead and send it on and we'll put it in line. With that being said, we will go ahead and get started. So Dr. V, why don't you tell us a little bit about yourself?
All right. Thank you, Don, and thank you, everyone, for joining us this evening to hear about a topic that I think many people are interested in and maybe just a little bit confused about with all the new recommendations. But before we get started, I will give you a little bit more of an understanding of who I am. My name is Nathan Voris. I live in Columbia, Missouri. I'm an equine veterinarian. Live with my family and my pets here. I've been married for 15 years to my lovely wife, and we have a 7- and 10-year-old. As far as school, I went to the University of Missouri for both undergraduate and veterinary school. I have an animal science degree and went to veterinary school there as well. And while I was in veterinary school, I had the great opportunity to take care of this beautiful team of mules, which serve as the mascot for the University of Missouri College of Veterinary Medicine. We attended about 50 events all over the state of Missouri, taking the mules and participating in parades, and you name it, we did it. And it was a very wonderful experience through school. After school, once I graduated in 1999, I went to Lexington, Kentucky, and spent a year at Root and Riddle Equine Hospital doing an internship. I was one of 10 interns that rotated through different services within the hospital and really got a good, firm foundation in practice during that year. Following that, for the next 10 years of my career, I was one of the associate veterinarians at Equine Medical Services in Columbia, Missouri, where I provided services for about a 60-mile radius around Columbia, equine-only practice. I was one of 6 veterinarians in the hospital at the time, and as you can see from this picture, it's a beautiful campus and provided a variety of services throughout mid-Missouri. Today, I work for a pharmaceutical company that produces animal health products for basically any animal that you can think of around the globe, and this includes various equine products. And part of my job as an equine technical services veterinarian is to go around and talk to horse owners and veterinarians alike and really give them a firm understanding of how, to best use the products that we produce. And this is something I really, really enjoy doing, and especially when it comes to the equine dewormer products. And so when I go out and talk to groups of people, I always try to get a better understanding of where they are and what they're comfortable with by asking, basically, what do you give your horse? And so, Dawn, if you want to open up the chat and open up the poll, for this question, we're going to put up in front of you, in front of everyone to.
They should see it now.
Up yet, but we're going to have everybody just give the answer as to what product that they gave their horse last.
So you should see this quiz in front of you now, and I see some results coming in. Thank you, everybody. It gives us an idea of, as Dr. V goes through his subject here, it tells us which different products he should talk about and what their best uses are and such.
Absolutely, and we will get back to the results of this poll later on. But I wanted to give everybody just a few more seconds to click in. Don, if you see that they're slowing down, we'll go ahead and continue.
Okay, and We are back to your screen.
All right, thank you. So again, we'll come back to the results of that poll in a few minutes, but I wanted just to cover a little bit of the agenda, discuss, why change? I think a lot of us might feel comfortable in what we're doing and feel pretty confident that things are going well, so why should we change? And I'm going to answer those questions. We're going to talk a lot about the most common equine internal parasites. So what is your horse actually exposed to? And what do these worms do to your horse, and how can you best treat and minimize the risk of disease from those parasites? We're going to go over the AAP parasite control guidelines. The AAEP is the American Association of Equine Practitioners. It's the world's largest association of equine veterinarians, and this group has produced a very thorough document on parasite control guidelines, given the climate today and the changes that have been recommended by these experts. This is really the backbone of this conversation. And finally, what I want to do is make sure that everyone on the line is equipped with knowledge that will help you develop a parasite control plan specific to your horse's needs. Give you some good informed questions to ask your veterinarian when it comes to setting up a specific plan for your geographical region and for your horse and the risk factors that they experience. Okay, so why do we have these recommended changes? The number one reason is resistance. Parasites are a biological organism, and they want to survive just like every other biological organism. And over the years of being exposed to dewormers, deworming session after deworming session after deworming session, they've built up some resistance. And actually, the resistance is quite widespread throughout the United States. The reasons that, as I mentioned, it's overuse of dewormers, so deworming when the horse really doesn't need it, overuse of a single class of dewormer, and, back 20, 30, 40 years ago, there was really only one or two classes of dewormers, so they got overused, and lo and behold, those are the ones that we're having the least efficacy with now. And then finally, underdosing. And the two biggest reasons why we underdose a horse is, one, we don't get a good weight estimation on the horse, that we think our pony weighs 1,000 pounds when they weigh 1,200 and underdose them, or we stick the tube in their mouth and some of it falls out. And how much of it fell out, well, we don't really know, but we've only got 200 pounds left, so we'll just give the rest and call it good. Those are the two biggest reasons that I think we've developed resistance, or we have the perception of the dewormers not working as well as they used to. As a result of this resistance, our focus has shifted from a rotational just kill all the parasites to more of a focus of which parasites are the most concern to our horse today. And with adult horses, those greater than 3 years of age, the small strongyle and tapeworm are the biggest concerns. And with the youngsters, foals, weanlings, yearlings, anything less than 3 years of age, the roundworm and the tapeworm are the two biggest parasites of concern. And we'll go through all of these parasites in the slides to come. But rather than just blanket shotgun approach with our deworming, we're really focused on these parasites with these age groups of horses. Another concern that we all need to be aware of, and one of the reasons why we're making these recommended changes, is that not every horse needs to be dewormed 4 times a year or 6 times a year. Some horses are very resilient to becoming infected with parasites, period. And as a result, these horses, and it's actually most horses, can get by with about twice a year deworming, strategically timed with specific products twice a year, and the horse is going to be just fine. Okay? There is no one-size-fits-all program, and so whenever we say every horse gets dewormed every other month, we're kind of throwing out the biology of the worm and the needs of the horse. We're throwing them out the window and just giving chemical classes to horses that they don't need. Okay, and then finally, an individualized approach will control your horse's parasites and slow down this resistance that's cropping up. For any of you that um, do any reading on parasites in New Zealand and Australia, the small ruminants, the sheep and goats down there, have had such dramatic parasite resistance that almost nothing works. And in fact, they're having to group 3 products together and give at the same time just to kill the parasites now. So there's no, single product available that works. And likewise, in the United States, the resistance is not that bad in horses to that point yet. However, there is no single product that kills all of these worms. So I mentioned that the roundworm was one of the primary parasites of concern in foals. Well, the dewormer that does the best against the roundworm does almost nothing against the most significant parasite of the adult horse. And likewise, the tapeworm requires a specific dewormer altogether. So, getting a firm understanding of the different parasites that your horse is going to be exposed to will really help you make informed decisions when it comes to taking care of your horse. So how do horses get parasites? Well, this schematic is somewhat in general, and don't pay a lot of attention to the words, but I do want to just kind of show it is a vicious cycle. Anywhere there's horses, there's parasites. They're ubiquitous to horses. They just go right along with the horse. And most of the parasites are on the pasture. So a horse that goes out and grazes picks up either larvae, which are the immature stages of the parasite, or they pick up the eggs, and then the eggs mature within the horse and become adults. Again, resume laying eggs where the horse passes the eggs in the manure onto the pasture, and the cycle continues. So anywhere you have a horse, you have parasites. Controlling, as you might expect, controlling the parasites of the horse, there is some pasture management things that you can do by, picking up or rotating pastures, a variety of things that you can do to reduce the exposure that will, in addition to your deworming program, help to minimize the risk to your horse. Here's the list of the key parasites we're going to talk about: large strongyles, small strongyles, roundworms, tapeworms, pinworms, and bots, and then Habronema, or the stomach worm, which is responsible for summer sores. We'll dig into each one of these and what diseases they cause, and how to protect your horse from them. We'll start with the large strongyle, and this parasite was the one that scared the pants off of everybody many, many years ago. The larval stages of this parasite, so once the horse is infected and the immature worms are in the horse's body, part of their life cycle is spent within the arteries of the horse, and specifically one of the arteries that supplies blood to the intestines. And as you can see from these illustrations, this is one of the arteries that's been dissected, and you can see that it's not a smooth surface, that it's really rough. It's been chewed up basically by this parasite. Little aneurysms would occur and basically cut off the blood flow to segments of the intestine and cause a pretty severe, most of the time fatal colic. Now, this was the parasite of concern, the biggest parasite of concern about 40 years ago, before the advent of ivermectin and moxidectin. With the advent of that chemical class of dewormers, these clinical cases almost 100% ceased. Okay? Now, the nice thing about this parasite is that it has a very long life cycle. So if you use ivermectin or Quest or moxidectin, one of those two products twice a year, once in the spring, once in the fall, your horse will never have these clinical signs. And that's why, I mentioned that most horses twice a year. This is the baseline for it. As long as we can give at least twice a year, you never have to worry about the large strongyle. And in fact, the large strongyle and the frequent use of products before we got to ivermectin, just to control the large strongyle, has caused this parasite to become our biggest problem now. And this is the small strongyle. And if you've ever looked at manure and seen these little about 1-inch red worms, that's what they are. And in fact, this one truly is ubiquitous to horses. Everywhere there's a horse, this is the one that they have. And if you have a fecal sample examined by a veterinarian, the eggs that are on that slide are 99% going to be this parasite's eggs. They're everywhere. Now, the overuse of dewormers to control the large strongyle before we had ivermectin and moxidectin led to a lot of resistance with this parasite. So now those chemical classes still work pretty well. Well, they work really well. Ivermectin and moxidectin work really well for this parasite, but the benzimidazoles, Panacur, and oxybenzole don't work very well at all. And the Strongid has, it's hit or miss. It's very geographical as to how well it works. So this one's the tough one now, and this one's the parasite of greatest concern for adult horses today. And this is the one that we're really concerned about, and making sure that we're appropriately treating horses to the extent that they need it, but not over treating it, because this is the one that is developing the resistance. Okay, in addition to the resistance, one of the other big struggles with this parasite is that it has one of its life stages, the larva burrow into the intestinal wall and can just hang out for up to a couple of years. And we call this the encysted stage, or hypobiosis, or I've put in parentheses it's hibernating. It's a great life cycle management tool, basically, that if there's plenty of parasites in the bowel laying eggs and contributing to the pasture contamination, then these larvae are just happy just to arrest their development and hang out there until the bowel is empty, and then they come out, mature, and lay their eggs. They also, during certain times of the year, if it's really, really hot or it's really, really cold and the eggs aren't going to survive on the pasture, these larvae somehow know to go into that arrested stage and just wait it out until the grass turns green again. The biggest problem with that is, one, it causes damage to the intestines, and two, there's only 2 chemical compounds that get that stage, that arrested stage of development. And those are moxidectin with a single dose, or the power pack, or the power dose. And recall what I said about Panacur, the fenbendazole in general has really lost efficacy, even at that power pack dose, against this parasite. And so honestly, in adult horses, there's very limited reasons to use a power pack in an adult horse. Okay, this illustration shows you what that intestinal wall looks like when it has a bunch of these parasites in their encysted form, when they're hibernating. And when you get a heavy infection in this stage, it can really limit the horse's ability to absorb nutrients, water and food nutrients, okay? Because they take up space, they damage that tissue, and if they all wake up and emerge from the wall of the intestine all at once, it can cause a very rare but very, very serious disease process called cyatostomoniasis, and it's a really bad deal. The horse gets severe diarrhea, they get toxic, and about 50% of them die. But again, that's a very, very rare thing to have happen, and it happens only when the infection is very severe, okay? The biggest concern in foals is the roundworm, and this one's a much larger, it's hard to tell from the picture, but that's 6 to 9 inches long, those parasites. So when they come out, you know it, you don't miss it. They're not just this little 1-inch worm like the small strongyle. These are very large. And it primarily affects foals under 6 months of age. As a horse matures, they actually develop a resistance to getting infected by this parasite. So you don't have to worry about this one as much in adult horses. Once they're about 18 months of age, horses have a pretty good immunity against being infected by this parasite. This parasite has some pretty dramatic impacts on foals. That you can see these big worms, and this is a surgical picture of a foal that colicked and just was packed with these 6 to 9 inch worms. Just caused, a disruption of flow through the intestines, colic. So, of course, if they don't colic, they're going to have poor weight gain because they're not able to absorb nutrients whenever there's all those parasites in there either. Diarrhea, again, nutrient absorption. Pneumonia and snotty nose. Now, this one's a little bit of an interesting one. Part of the life cycle of this parasite, the larvae actually burrow through the liver and through the lungs, are coughed up by the foal, and then swallowed, and then they become adults. So this parasite is very damaging to internal organs of the foals, and it's really, really important that we make sure that we take care of foals adequately, because age is one of the biggest risk factors for parasitism. And with this particular parasite, those ivermectins and Quest products, they don't work very well. And the products that don't work very well with the small strongyle work great with this one. So Panacur, oxybenzole, Strongid for the most part, they all work really well with this particular parasite. So as you can see, there's still a place for all the products that we have on the market, but knowing which products are appropriate for which parasite is very, very important. Okay, we're moving on to tapeworms. Tapeworms are a parasite that we worry about with pretty much all age groups, and they latch on to the wall of the intestine right at the end of where the small intestine feeds into the large intestine. We call it the cecum in the horse. We refer to it in people as the appendix. So that's where these parasites kind of latch on and feed, and they can cause irritation. You can see there's a really dark pink ring right there. Well, that's this intestine trying to telescope into the cecum, and that's not a good thing. That can cause a pretty severe colic. It's called an intussusception. I think maybe many of you have heard that term before. When the intestine telescopes in, it's almost always a surgical emergency. They can also cause an ileal impaction, so an impaction of feed material in that very end portion of the small intestine, right as it feeds into the large intestine. And it can cause a lot of gas colic. That's probably the primary thing that this parasite causes. Horses experience these symptoms when they are heavily infected. Severity of the damage is proportional to the magnitude of infection, and I think we can say that with every one of these parasites, but tapeworms for sure. This parasite's pretty interesting because it requires a forage mite that's on the pasture. Any pasture with green grass has these forage mites. Well, these forage mites actually eat the eggs that are in the horse's manure, eat the tapeworm eggs, and then incubate the egg into a little infective larval stage. And then as the horse is out grazing, they mistakenly eat these mites and get tapeworm infections. So it shouldn't surprise anyone that horses in areas where there's lush green grass are more exposed to tapeworms than horses in relatively arid environments like Arizona, New Mexico, Colorado, out west. Anywhere there is green grass, this pasture mite lives. And it's really an important part of the ecology. A question that I always get, so I'm just going to kind of head it off at the beginning, is can you kill this mite? Well, you wouldn't really want to, because this mite is responsible for breaking down the thatch layer. So if you live in a place, the grass gets green, it gets burned up in the summer, it freezes in the winter, dies, and new grass comes up underneath it. This pasture forage mite is actually responsible for breaking down that thatch layer into organic matter. So it's really actually very important to the healthier pasture, just not so great for the health of the horse. Some other parasites that I'll just mention that are of lesser importance are pinworms and bots. Pinworms are irritating to horses and irritating to owners because the horses rub their tail out when they have these infections. Probably the best products for pinworms are just like roundworms, the Strongid and Panacur Amphicide. Those are the best products for pinworms. Whereas bots, it's only ivermectin and moxidectin. Bots are actually the larva of a bot fly, and they look like a little bee, and they lay their eggs. It's a small picture, but that lower right picture, you can see the yellow eggs on the horse's legs. They irritate the horse. The horse kind of rubs at its legs, picks up these little nits, and then gets infected. And those bot larvae, which is the picture to the left of the horse's leg, live in the horse's stomach over winter, and then are passed the following spring. They burrow into the ground, and then they come out as a little bot fly to restart the cycle. So the best time to treat with ivermectin or moxidectin is at the end of the bot fly season, if you live in an area that's lucky enough to have an end of the bot fly season. And then finally, the stomach worm, Habernema. It's another parasite that in and of itself doesn't really cause the horse that much distress. It can cause some stomach irritation to a horse, but the problem is the larva. The larva is actually consumed by a maggot in horse manure. The maggot becomes an adult fly, is still infected with this stomach worm larva, and it can, during feeding activities, deposit that larva in wounds or near junctions of skin where there's, we call it a mucocutaneous junction. So like the eyelids or as you can see here, the coronary band, or any wound. There might have been a scrape on that fetlock. They deposit this larva during feeding activities, and then that larva causes dramatic irritation, similar to proud flesh, but even worse, because they just will not heal. And this is the big problem with summer sores. The stomach worm in itself doesn't cause the horse that much trouble, and they're easy to control, but fly problems can really cause major problems when it comes to Habernema and the summer sores that they produce. Again, the ivermectins and moxidectins are the best products for this, but you can't just kill the stomach worm because you also got to kill the flies. Flies have about 1.5 miles flying distance that they can fly, so if your neighbors down the road aren't taking care of their horses' parasites adequately, then these parasites can fly to your farm and cause problems too. All right, so just a quick review. The large strongyles were the parasitic concern 40 years ago, but ivermectin and moxidectin has really quashed this one, and if you can deworm twice a year, you take care of this one. That parasite you're not going to worry about. Small strongyles are the ones that have the most resistance to the older compounds. Ivermectin and moxidectin are still quite effective. However, ivermectin can kill the adults, and moxidectin can kill pretty much all of the larval stages as well. Roundworms are the biggest problem in foals, and those older compounds are still highly effective against roundworms. So, you know, somebody might call it the white dewormers. That's Panicure and Anthracite, or Strongid are still very good in with regard to the roundworms. Tapeworms are those parasites that are carried by the forage mite. And I didn't mention this, but it requires a special chemical called praziquantel. So if you see a dewormer that says plus or gold or max, those have praziquantel in them, and they're effective against tapeworms. And the ideal time to treat for tapeworms would be at the end of the grazing season, because then the horse isn't exposed to these forage mites anymore. During the bitter cold and the bitter heat, these mites burrow into the ground and aren't really accessible to horses. So you don't have to worry about them during those times. But after the horses come off pasture, come through the grazing season, that's the best time to treat for tapeworms. Pinworms and bots are, you know, mostly an annoyance, not really going to cause the horse that much trouble. But again, pinworms, the white wormers, and Strongid are good. Bots, ivermectin and moxidectin are the only things that are going to touch bots. And then Habernema with the stomach worm, again, ivermectin and moxidectin are your best bets there. Okay, so I have a feeling that some of us on the line are still doing traditional rotational deworming. Actually, let's go ahead and put the poll results up real quick. And I'm, for some reason, not able to see it. So
okay, so we have 17% Quest and Quest Plus, 50%
okay.
Zamectrin Gold, and 33% ivermectin, and nothing for the other two.
Okay, very good. All right, so I mentioned, ivermectin. It doesn't surprise me that ivermectin is the number one um, chosen product. Um, and in fact, Zemectrin Gold is ivermectin and praziquantel. So those of you that have used the Zemectrin Gold have taken care of your horse's tapeworms. But if there's still pasture exposure, then the horse is getting infected, basically right away. So that's just something to keep in mind. You didn't do anything wrong. Don't think I'm being hard on you. But if you live in an area that has a frost, you might consider another treatment in the fall with a product that gets tapeworms. For those of you that have used Quest or Quest Plus, you treated the horse for the encysted small strongyles. That's great. You might have done it just a little bit early, just like with the tapeworms, because if the horse is still on pasture, if there's green lush pasture like I'm looking out my window seeing just some beautiful green grass in central Missouri, those horses are getting reinfected. So again, you might want to wait until towards the end of the grazing season and treat again for both the encysted small strongyle and tapeworms. Okay, and then ivermectin, you got all the adult parasites, but the encysted small strongyle and the tapeworms you haven't touched, and so you've kind of set yourself up perfectly for waiting till the fall to treat for those two parasites. All right, so we can cover more specifics at the end during the question and answer session, but I do want to talk a little bit more on how we arrange and make a plan for treating horses as individuals versus doing this traditional rotational deworming program. I mentioned that the traditional rotational program was basically instituted because of the large strongyle. At the time that horses were dying from this parasite, before we had ivermectin and moxidectin, we didn't have very effective drugs. They did kill the adults, but they didn't do anything to the larvae of the large strongyle. So you had to treat every 4 to 8 weeks with the drugs that we had at the time in order to keep your horse from succumbing to this really serious disease. Well, fast forward, now we have ivermectin and moxidectin. We don't worry about the large strongyle, but we haven't changed our habits when it comes to parasite control. We no longer have the parasite that caused this fatal colic. It's not a problem now, but we're still treating horses like it is. Okay, so that's the shift of focus, that we're focusing toward today's parasites of primary concern. I mentioned that if you treat twice a year, you're never going to have to worry about the large strongyle, and about 80% of horses are going to be fine with just those two treatments. However, additional treatments are going to be required based on fecal egg counts and risk assessment of the horses and the property. So let's break those two down. Fecal egg counts, I recommend every horse at least once a year. And the ideal time to take a fecal egg count is when the grass is green. If you're mowing your grass every week, then the parasites are in an environment, that green lush grass that's growing, the weather is right for parasites to survive on the pasture. So they are going to be having, an active life cycle. You're going to get a pretty good idea of your horse's shedding status. And I say shedding status because fecal egg counts aren't directly tied to the level of infection per se, but we do know that, the higher the egg counts, up to 500, so between 1 and 500, there is some correlation of how heavily infected the horse is. Above 500, it's just all over the map. But by knowing every horse on your farm's shedding status, which honestly doesn't change that much through the years, you're going to get an idea of which horses need more deworming to control that shedding status, that infection status, than the horses that don't shed very many eggs. And like I said, it says right here 50 to 70% of horses on average that are low shedders that are going to be just fine with the twice a year deworming. Okay, so that's the fecal egg count, and that's one of the factors that would tell you that your horse needs to be dewormed more often than just the twice a year. The other one is the individual risk factors. So I mentioned the age of the horse. Foals, Horses less than 3 years of age just automatically need more than twice a year. And we're going to get into the specifics here in the next few slides. But the age of the horse is the #1 risk factor. So even if you do a fecal egg count and it has 0 eggs per gram and you've got a 2-year-old, you need to treat that horse still more aggressively because their immune system is still developing. And even if you have a negative fecal egg count, it may not tell you how accurately how infected the horse is with parasites, because I can assure you there are parasites there. They may be in a larval stage, and larvae don't lay eggs. They may be in that encysted hibernating stage, and that stage doesn't lay eggs. They could be, migrating through some organs, and you aren't going to pick up any eggs because those parasites aren't laying eggs either. So the age of the horse is one of the biggest things to take into consideration when you're building your parasite control plan. The parasite life cycle, and we talked about those, geography and climate. There's really no use in deworming the horse when there's a foot of snow on the ground, and there's not much use in deworming a horse when it's 100 degrees outside and the grass is all burnt up. Horses, the vast majority of the parasites require there to be some green, lush grass before horses can get infected. Stocking densities, if there's more than 1 or 2 horses on an acre of ground, then you've got high stocking density and your horses are at a higher risk to be infected. So even with a low egg count, you may have to treat a little bit more frequently to protect those horses from getting heavy infection loads. And then pasture and manure management, again, if you can keep your pastures clipped, if you can rotate pastures, let them graze in one pasture, and then let that pasture rest for several weeks, the weather itself can help to decrease the infectivity of that pasture. The best thing that you can do is go out there 2 or 3 times a week and pick up the manure, but that's very labor intensive, and I know everyone on the line probably let out a gasp at me just suggesting that. All right, so foals, and we're coming down the back stretch, so we're going to be able to get about 15 minutes worth of questions here. Foals and weanlings during the first year of life need 4 treatments, and then that's against the roundworm. And recall I said that those older classes of dewormers are the best. The Amphicide, the Panicure, those are still highly, highly effective, and they're actually the drugs of choice when it comes to this parasite for a number of reasons, the efficacy and the mode of action. It actually causes the worm to starve to death. It does not paralyze the worm. So it's a dewormer that's a little bit easier on the foal with regard to the way that it kills the worm. You begin at 2 to 3 months of age with this with your deworming program. Your next one would be about 6 months of age, 4 to 6 months of age, depending on, if you start at 2, about every 2 to 3 months, you'd want to deworm the horse to make sure that the roundworms are under control. A fecal egg count is recommended around 6 months of age, and that's basically just to guide you if your deworming program is working. Do you have some small strongyles in there? And, would you on your 8-month dewormer maybe want to give a product that's more effective against small strongyles for that treatment versus the roundworm? All right. The young horse between 1 year and 3 years of age, they're still very immature. We still worry a little bit about the roundworm for about the first 6 months of this time frame. So making sure that you treat for the roundworm aggressively, but not forgetting about the small strongyle and tapeworm. And 3 to 4 treatments a year are required for this age group. We want to treat them as high-risk horses, and high-risk horses need strategic use of 4 times a year deworming. And then a mature horse, our focus is on the small strongyle and tapeworm. The vast majority of horses are going to be fine with 2 treatments a year during those peak shedding times when the grass is green, but always try to get it towards the end of the green grass time. So that's going to give you the best, the least amount of time for reinfection if you can get it towards the end of the grazing season. I live in an area that has 2 grazing seasons, a spring grazing season and a fall grazing season. The summer's usually pretty hot and the winter's usually pretty cold. So those are, the 2 times you'd want to target those ivermectin or moxidectin treatments. Okay, just those 2 times a year are going to cover you with for the large strongyles, the tapeworms, haberdina, and bots. If you know time those correctly, the small strongyles you'll also take care of, and then your annual fecal egg count, you're going to know the shedding status of that individual horse if you can do an annual fecal egg count and be able to adjust, additional dewormings as necessary. All right. So finally, to be successful, we need to, refocus our decisions not on a circled date on the calendar, but on which parasites are there, which ones are at the most risk of our specific horse, and address them head on aggressively, but just to the extent they need to be addressed. Okay, and your veterinarian, of course, is your best friend when it comes to putting these programs together. They're going to be able to help you walk through what the fecal egg count results mean and really guide you in which parasite and which dewormers are working best in your specific area. Like I mentioned earlier, resistance is seemingly widespread, but there's some areas that have it worse than others. So you definitely want to touch base with your veterinarian and formulate a plan for your specific horse. Okay, with that, Dawn, we're ready for some questions.
Wonderful, thank you. That was both very enlightening and somewhat ooey. That's a technical term, of course.
Yeah, it is.
It worked well for my diet plan for this evening. Thanks for that. I appreciate it.
There you go.
We do have a handful of questions. So first we have Susan, who is asking how to determine if a horse is being over or underdosed. If the weight is somewhat approximate, is there a better way to gauge weight, or is it better to overestimate weight or underestimate weight?
Well, I'll answer that to say that it's always better to slightly overestimate the weight, because all of our weight estimation tools are pretty subjective unless you have a scale. The two probably the best ways to estimate the weight on your horse would be with a weight tape, so around the girth. But an even better one would be to take girth measurement and length of the horse, and thehorse.com has a great tool that can help you calculate the horse's weight with those two measurements, and it's much more accurate than just the girth tape. Again, a little bit on the high side, about a 10% overestimation is probably better than just hitting it on the nose. And all of the dewormers have a great safety profile. 3 to 5x is the minimum that you can overdose the horse. So if you have a 1,000-pound horse, you'd have to give them 3 to 5 tubes before you would start seeing any overdose effects. I don't know of anybody that would ever overdose their horse that much. With a tuba quest, it's a 1,200-pound dose basically. If you have something more than 300 or 400 pounds, you cannot overdose them. Okay, so I wouldn't worry too much about overdosing. Underdosing can cause a big problem with resistance and lack of efficacy.
Okay. The second question is from Pat, and she tells us, hi, Dr. V. I have a small horse farm, 3 to 5 horses. Each has their own pasture. No one leaves the property. Any new horses coming in have to have a clean fecal. We've always had good paste wormed every 8 weeks using double Strongid in the fall, Zymectrin Gold 3 times a year, Panicures, and one other. As of last year, we were told to do fecals in the spring and fall, but unclear about worming in between. Would you give us your thoughts, please? We live in the Northeast.
So this is kind of a typical program of what I think a lot of people have utilized, and I love the fact that we got all of this information. This is great information, and from a management standpoint, it sounds like Pat is doing a fabulous job managing the horses and making sure that they're not exposed to parasites, overexposed to parasites. Now, her deworming program is a little bit over the top. we're giving every 2 months a dewormer to horses that have their own paddocks, so they're not spreading parasites around. They're basically exposed to their own parasites. So their pasture burdens are probably pretty low. The fecal egg counts twice a year. I would love to hear what those egg counts are. I bet they're probably negative, 0. And so what I would recommend is that if these are adult horses, so horses over 3 years of age, drop it down to twice a year. Continue doing those fecal egg counts, at least one a year. And if you've got one that's high, the twice a year is great. You're not going to hurt anything. And if something were to happen, um, with that horse's health and they become a little bit immune compromised and get heavily parasitized, that twice a year is going to make sure that you don't miss it. But she's basically treating for tapeworms 4 times a year by using Zomectrin Gold 3 times a year and double dose of Strongyl in the fall. So I think we're covered there. She should probably be able to do the Zomectrin Gold once a year. She hasn't dealt with the encysted Strongyls, so that might be something that we add into a Quest in the fall, or Quest Plus in the fall. I think that's probably the most strategic dewormer for the fall is Quest Plus, because it's going to get the encysted Strongyl and the tapeworm all in one dose, and you're not going to have to worry about giving 5 doses of Panicure and a Zomectrin Gold to get the tapeworms. The Northeast, definitely she's going to be entering the end of the grazing season here in the next month or so. So that would be about the time that I would say give that last dewormer and then not worry about it again till spring. So she doesn't need to deworm over the winter. And then once the grass turns green in the spring again, have the veterinarian do the fecal egg count, and then you can make your plan based on that.
And a quick follow-up from her, do time of year or geographical location indicate what type of dewormer should be given and when? So you answered
Absolutely.
some of that in your
Yeah.
comment, but
Yeah, so geographical location does make a big difference, because you think about the Northeast and even where I live, the grass is green right now. We're kind of on the tail end of our grazing season, so the tapeworm is something that has built up in the horse, and making sure that you get a good tapeworm treatment in addition to the encysted small Strongyl treatment at the end of the grazing season is really good. Now, if you live in the South, you're probably still it's summer still, and the grazing is not that great, but in the winter you're going to have your better grazing season. And so for the South, where there's a winter grazing season, your tapeworm and encysted small Strongyl best strategic time for treatment would be at the end of that spring grazing season before it gets hot again. So those subtle differences, basically I like to look at it as grazing seasons, not spring and fall. That tends to be a little bit more universal language, that if you're grazing, whenever your grazing season is, north in the summer and south in the winter, at the end of that grazing season is the most strategic time to treat the encysted small Strongyls and the tapeworms, which are the two most, the biggest concerns for adult horses.
great, thank you. We have a couple of more that have come in.
Okay.
This one says, how and when is the best time to perform a fecal exam? What type of sample should be used for an egg count? You talked about that a couple times. How do we do that? When is the best time? Do you need to do all of your horses?
Okay, those are fantastic questions, and so I'll just kind of tick them off one at a time. I recommend that every horse on the property have a fecal egg count at least once a year, and the reason for that is, if you recall, and I'll just, at the risk of giving everybody seasickness for a second, jump back to this slide, that you can see 50 to 70% of horses are going to be low shedders, 10 to 20 are going to be moderate shedders, and 20 to 30 are going to be high shedders. So let's say that you take a fecal egg count and you just happen to get the 2 horses out of your 5 that are high shedders, or the 2 horses of your 10 that are high shedders. You're going to be treating all the horses now as high shedders, which are 4 times a year, whereas really probably those horses are the high shedders, the rest of them are low shedders, and you could save your money on the other 8 by just doing twice a year. So you really do, there is a cost benefit to doing a fecal egg count and being able to strategically treat only those horses that need more aggressive treatment with more aggressive treatment versus the rest of the herd that's just going to, truck along and be fine with the twice a year. The best time of year is when the grass is green. The parasites require a nice, lush, grassy environment, most of them, in order to survive and to be effective to horses. And the sample that you'd want to take is a sample that is less than 12 hours old and has not been frozen. So if you stall your horse at night, that pile that's there waiting for you when you go to feed in the morning, just get a baggie and put 1 or 2 road apples in the baggie, and you can put it in the refrigerator and have up to 7 days to drop it off at your veterinarian's office. So it's one of those things that you do have time, and there is some flexibility. Fresh is good. You don't want frozen. You don't want cooked manure. So within 12 hours of the horse eliminating the manure pile, and within 7 days to be read out by the veterinarian if it's been refrigerated.
So
And
Nancy
that's
has a similar
probably,
question.
those are the, okay.
So Nancy has a similar question. Only hers is about the foals and younger horses. She asks, how often should you have them have a fecal egg count, since they're so much more susceptible to several of these different types?
Absolutely. So they are more susceptible, and the fecal egg counts for foals and young horses really more guides our choice of dewormer than it does the frequency of our deworming program. Okay, only the adult horses, the horses older than 3, are on this minimum of 2. Those young horses, if they're 3 or less, they need 4 times a year, period. So the fecal egg counts, if you can do a fecal egg count, once or twice a year on those youngsters, it really just guides your decision on which dewormer to use next, because we don't have a silver bullet dewormer. If there's roundworms on the fecal egg count, which are those brown worms on that slide, or that brown eggs on the slide, if there's roundworms, you'd want to choose Panicure or Anthelcide. Or if it's the most of the rest of the parasites eggs on that, those are the small strongjaw eggs, then you'd want to choose ivermectin or Quest. And depending on how old the foal is, would also guide your decision as far as ivermectin or Quest. You don't want to give Quest to foals under 6 months of age.
Okay, thank you. Another question, how do you determine if a horse or a barn has developed a resistance to a particular dewormer?
Okay, that's a great question. Most of the time with these parasites, you're not going to be able to eyeball and say that horse has worms, this horse doesn't. These parasites can cause inefficiencies in digestion, but most of the time they're not going to cause overt disease. It's very, very rare for it to cause disease. So the horse can just eat more and look fine. The only way that you can tell if the horse has parasites, or kind of sort of gauge the level of parasitism, is by doing the fecal egg count. And likewise, the only way you can tell if your dewormer has worked is to do a follow-up fecal egg count. So what you do is you deworm, or during your annual fecal egg counts, you say, wow, we got a bunch of really high egg counts. We need to kind of adjust what's going on here. Treat the barn, and then come back 14 days later and sample those horses that had the highest egg counts. And you would like to do at least 6 of those horses. You don't have to do all of them, because they're all exposed to the same parasites, and you don't have, resistance is not an individual horse thing. It's the parasites in the environment are getting the resistance. It's not that the horse just isn't, the drug isn't working on the horse, it's the drug isn't working on the parasites. So 14 days after you do your initial treatment, come back, get a second fecal egg count from those horses that had the highest egg counts, and then compare them and see how much reduction you had. You need to have at least 90% reduction. So if you have 1,000, you'd like it to be 100 or less. on 2 weeks later to have a 90% reduction. Um, if you don't, then there's still some things that could be going on other than resistance, but it's a warning sign anyway that those dewormers aren't as effective as they should be on that particular farm. But you can't do it with just a single horse, and you can't do it if the horse just has a 200 egg count, because the fecal egg count itself is just not sensitive enough to um, be able to compare a pre and post sample if the egg counts are low. You really need to have a high shedding individual and to see accurately how well those products worked, and you need to spread it over several individuals.
Okay, thank you. We had another question come in. Heidi has asked, what is the typical cost of an egg count?
Okay, that will vary with practices. I think most of the time I see them in between $15 and $25 is what veterinarians charge for a fecal egg count. Some veterinarians can be less and others more. It really depends on your geographic location. But just call and ask your veterinarian how much they charge, and if they don't perform that service, um, if you live near a vet school, most of the veterinary schools have a diagnostic lab that you can take your sample in, just drop it off, and have them run the sample. Or there's various other state diagnostic laboratories that might offer that service as well.
Okay, I see that we have just run out of time. Thank you, everybody, for coming to join us, and thank you so much, Dr. V, for helping walk us through this. It has been very helpful to our understanding, and if you happen to catch this and want to hear a little bit more about it, or want to rehear some of the things that Dr. V walked us through, we're actually going to produce this into snippets for the specific questions and one big block of that 40 minutes of talking, and put that up on EQ Stable in the coming weeks so that you can rewind and hear that section you didn't quite catch the first time. So thank you, Dr. V. We really appreciate you.
All right. Well, thank you for having me tonight, and everyone enjoy the rest of your evening.
Thanks, everyone. Have a great day.